Teaching children with special needs. Today, under this topic, we are going to deal with the lesson Teaching children with hearing impairment in an inclusive setting. Objective. The objective of this lesson is to understand the adjustments, accommodations in a classroom required when we are teaching a hearing impaired child in a regular classroom. Hearing impairment simply means the inability of someone to hear as completely and as adequately as normal hearing people. Actually, hearing is extremely important. Why? Because hearing keeps the people aware of the signals and sounds which may ensure our safety and security, and hearing constantly provides the people with information about the surroundings, and it helps the people acquire language, and hearing gives the people the pleasure and artistic satisfaction. It keeps the people linked with each other. Hearing helps to understand everything about the environment. To understand hearing impairment clearly, we have to know a few more important points. The first and foremost important one is that we must understand that the population of the individuals with hearing impairment are highly heterogeneous. That means the functioning level of the individuals with hearing impairment can be different from one another. For example, we can meet a child with hearing impairment who is able to manage verbal communication very well, and the next child with hearing impairment may not be able to either talk fluently or read or write adequately. Children with hearing impairment generally can do almost everything that an non-impaired child can do. But what actually each child does or does not in reality depends on many factors. Due to these factors and the role play on the functioning of the child, it is difficult to predict what a particular child with hearing impairment will be able to do or will not be able to do. So, we will see some of the factors which impact the functioning of the child with hearing impairment. As we all know, hearing impairment can be by birth. It can be acquired prelingually or acquired postlingually, and sometimes hearing impairment also occurs because of aging. Hearing impairment can be in one ear or both the ears. Hearing impairment can be of various degrees like mild hearing impairment, moderate hearing impairment, severe hearing impairment, profound hearing impairment. Hearing impairment can be reversible. That means hearing impairment sometimes can get corrected by medical or surgically treated, or it can be irreversible. That means it is not medically treatable. Hearing impairment can be temporary or it can be permanent. Hearing impairment can coexist with other disabilities or medical concerns. What a particular child can do or cannot do depends on all these factors, and the achievement of the child also depends on several other factors which are equally or sometimes even more important than the factors we have already said. So, now let us see some of these environmental factors on which the achievement of the child depends. The first important point is whether this child with hearing impairment has got access to communication either through sign language or through hearing aids. Whether the child has got this access to communication and with the hearing aids benefiting the child optimally or not. Whether the child is blessed with full family support or not. Another important environmental factor is that whether the child got a timely early childhood intervention or not. As we all know, hearing impairment is a very broad term and can be used to describe the complete or partial loss of hearing. Hearing impairment can be difficult to identify early because babies are all who are born with deaf will use their voice. They gurgle, babbling will often be synchronized with the caregivers as a result of the facial expression, body tension and movements. So, the greatest challenge for the persons with hearing impairment is difficulties with communication, because majority of the people focus on the oral communication methods. Even as teachers and parents, we often forget that communication includes the movement and facial expression in addition to the sound. It is therefore very important that communication in a way that seems very natural for us, using all modes of communication, movements, facial expressions, sounds and words. So, after knowing about what is hearing impairment, now let us see what is the importance of the early and appropriate intervention. When the children with hearing impairment are not identified early and given appropriate assistance or additional support beyond what would otherwise be required, will have to be offered during the school years. And even the children with mild hearing loss can miss much of the spoken information and discussions in the classroom unless we are aware of their hearing loss and make the changes the way we teach and interact with them. Many children with hearing impairment are inappropriately labeled as having problem behavior or learning difficulties. It is important that we realize how difficult it is for many children who have profound hearing loss to develop language unless they have access to the early intervention programs and the sign language instructors or personal tutors. Now, we will see the modes and means of communication these children with hearing impairment will have. The modes and means of communication. Children with hearing impairment use oral or manual means of communication, or sometimes a combination of both. Oral communication includes the speech or vocal communication, lip reading and the use of the residual hearing, while manual communication includes the sign language and finger spelling. So, the total communication is a combination of both oral and manual communication. After having understood what is hearing impairment, the importance of early intervention and the means and modes of communication in a hearing impaired child, now let us move on to see some practical tips when we are teaching a hearing impaired child in a regular classroom. The practical tips. First, organize the classroom so that all the children are sitting in a U shape. In this way, the children can see each other, and which will make it easier for the children with hearing impairment to use the sign language or read the lips and to understand the mimics, thereby making it possible to participate more actively in the classroom activities. Spend some time giving face-to-face instruction, since group situations can be quite challenging for the children with hearing impairment. And when speaking to the child with hearing impairment, look at the child directly. Speak slowly, clearly, but not too loud. By using short and simple clear sentences will help a child with hearing impairment. And always be consistent in the use of language. Use clear mimics and gestures. And another important tip is the use of natural signs. Work together with a audiologist to teach and encourage the child to use his or her residual hearing to a maximum extent possible. Even if the preferred means of communication is sign language or manual language, the residual hearing should be encouraged in the child. Another important tip in the classroom is reducing all the unnecessary noise, as multiple sources of sound will make it more difficult for the child to use his or her residual hearing. This is also important if the child is using a hearing aid. The focus should be more on content than on the grammar. When assessing the writing of the children, primarily using the sign language for communication, because grammar of sign language is very different and difficult from the written languages. So, these children are in fact writing in a second language. Now, we will see what are the need for specific approaches. Using the other senses as medium of learning, like using the gestures, body language, expressions, lip reading, and using adopted materials such as visual or sight vocabulary to provide first-hand experiences to these children with hearing impairment, and usage of assistive devices such as hearing aids, and to teach how to access the sound based information to the children with hearing impairment. Let us see the need for specific considerations. What are the specific considerations which should be taken into account when we are having a hearing impaired child in the classroom? We should make sure that we are aware of the learner's language abilities and preferred language learning style to ensure the inclusion into a normal regular group. When you are having a student with hearing impairment in the group, reduce the background noise or request for a classroom that is away from the noise. Allow the hearing impaired child to sit where they wish, because hearing impaired child can lip read just sitting in front of the group. Face the hearing impaired child directly when speaking to the child, and always keep in mind to use a clear speech. And make sure the room is well lit to allow the student with hearing impairment to see the facial expressions and lip reading. Some of the suggestions when having an inclusive classroom with a hearing impaired child. The first suggestion is that to understand the nature of the hearing impaired students' hearing loss and how you can include the student with rest of the class. The focus should be on development of the language, communication and concepts. If possible, assistance can be taken from the experts, educators and family members, the speech therapists, to enhance the teaching in an inclusive classroom. So, these are some of the practical tips which can be used in a regular classroom when having a hearing impaired child in the class. After having understood what is hearing impairment, the need for early intervention and some practical tips, now let us move on to see what adaptations and strategies should be followed. Adaptation. Adaptation means the changes that we need to bring about so as to make anything more need appropriate. We already have seen that children with hearing impairment have different and diverse educational needs. Hence, it becomes very obvious that they need an adaptation in the curriculum. The curriculum existing in the mainstream schools is in many cases difficult and faster for a hearing impaired child. But this does not mean that they have to be separated in a special school on the basis of their different needs. Keeping them away from the mainstream curriculum will destroy the whole concept of education in the least restrictive environment. Therefore, it is necessary to make some adaptations. Different special children with hearing impairment may need different adaptations. But in general, we can say as far as possible, 1 or 2 curriculums should remain unchanged. In an ideal adaptation, the content is not changed. Instead, the teacher provides multiple means for students to learn and respond. This is not at all difficult. By varying teaching aids, the teaching and strategies, the teachers can very well make a classroom teaching successful for a hearing impaired child. It is for the teachers to provide a learning environment and introduce supporting material to make learning easy for a hearing impaired child. Making the task easier for the child does not mean reducing the task. Understand the children, and it is necessary to understand that each child's learning style and provide some type of encouragement for him to learn. Each child with hearing impairment is unique in his or her communicative needs. Though all the children have this hearing loss in common, all of them have different degrees and types of hearing losses. Few of them can benefit from hearing aids. Some need additional support like speech, reading and visual information. Some of them may respond quickly, but sometimes they may be unable to make appropriate or proper utterances because their speech is inadequate or because their language or vocabulary is insufficient to express themselves. Their communication also gets affected by the group size and other children who expresses vocally or verbally. It requires different methodologies for learning purposes without making substantial changes in the subject area. A good teacher can teach all children effectively irrespective of their disabilities. Teaching from textbooks. Textbooks are the most significant learning resource. However, because of language inadequacies, the textbooks contribute difficulty experiences by the child with hearing impairment. So, the textbooks are actually written for the non-impaired students without language difficulties. So, these textbooks may concentrate only on the content, not paying much attention to the language. They may lack a conceptual coherence. Sometimes the text is on high concept density. This means new vocabularies and terms are introduced by the textbooks are vast. Children often need some adaptations because of these high concept density textbooks. Now, let us see how the textbooks can be adopted or modified for the child with hearing impairment. The first one is the language complexity. So, instead of using the large or complex sentences, the teacher can make it into a simple and short sentences by adding more examples to it. Organization of the content. Adding bullets or summarizing the points, numbering the points or underlining or highlighting the content helps the child with hearing impairment. And next important way of modification is visual support with illustrative examples so that it helps to understand the lesson and exercises. So, these are some of the curriculum adaptations a teacher can make when having a hearing impaired child in the classroom. After having understood what is hearing impairment, the need for early intervention, the modes of communication and some practical tips and the curriculum adaptations and teaching strategies when having a hearing impaired child in the classroom, let us now move on to some principles. Principles when having a hearing impaired child in a regular classroom. The centrally sponsored scheme of the universalization of the education visualizes the same learning experiences will be provided to both disabled and normal children studying in the school or inclusive education schools. But hearing impaired children, like any other disabled children, have difficulty in understanding some of the content areas which include more of the verbal concepts. It becomes therefore very necessary to adapt the curriculum to the needs and difficulties of the children. So, let us see some of the principles. While adopting a curriculum to the needs of the hearing impaired child, the objective of instruction should be same for the hearing and normal child. Only the learning materials and methodology may be modified. The learning material and the methodology can be modified in such a way that it will not disturb the majority of the normal children studying in the class. The second principle is that ideally speaking, the ratio between the hearing impaired and the normal children in a particular classroom should be 1:5. The hearing impaired child should be asked to sit in front benches or in front line along with a normal child. This will help the child to hear well. If a hearing impaired child is made to sit on one side in the front line, then the teacher must arrange to make sure that the better ear of the child is towards the class or towards the teacher. Then the third important principle is, in an integrated setting, the normal peers are encouraged to participate in education and training of the hearing impaired. They can participate in correction of the specific learning problems, teaching spellings to the child, articulation, new concepts and some other curricular activities. Then the fourth principle is that the teacher has to see that the hearing impaired child is using the hearing aid regularly in the class, so that he can check from time to time the working condition of the hearing aid also. The next principle is, the hearing impaired child need to develop adequate speech and language patterns. Supportive aids like the recorded tapes, articulation charts, speech trainers, photo albums and concrete objects, visual cues should be used for speech training, speech correction and language learning. The hearing impaired child have difficulty in learning abstract concepts and difficult words. So, a holistic method based on fingers, pictures, concrete experiences, audio-visual aids, role-playing, dramatization, all these can be used in a holistic way to teach a new or difficult or abstract concepts. Hearing impaired child have a primary difficulty of learning language and speech. Since language learning is basic to learning all other subjects, the hearing impaired child, owing the difficulty in learning the language, have problems in learning the other subjects also. If the hearing impaired child can be helped to learn language and speech, the patterns in their problems and learning the other subjects can be sorted out very easily. The resource teacher should keep a record of what the child knows and what he can do and what he cannot do, and plan the lessons according to the educational needs of the child. When teaching a hearing impaired child in a classroom, the adjustment of material and methodology can also be done with the resource room teaching. The teacher should identify the learning difficulty of the hearing impaired child subject wise and suggest the remedial exercises accordingly. For developing the sound discrimination and teaching the child to speak certain sounds, the resource teacher should give corrective exercise to the hearing impaired child in the resource room. Hearing impaired child have a faulty patterns of language, learning and usage also. Generally, they have a misarticulation problem and as a result, they also spell words wrongly. So, these are some of the teaching strategies and principles. The first educational provision is the use of hearing aid. Hearing aid is very necessary for hearing impaired children for their training and education, because hearing aid has been proved to be very effective. But the hearing aid should be selected according to the degree of the hearing loss. Since it is delicate and complicated instrument, it should be handled very carefully. Headphones and low speaking systems may also be used to enable the children to have a clear and stronger sound. The next educational provision is occasional training. Emphasis was placed on occasional training by different experts in their studies on hearing impaired children. These children have advantage of residential type of schools, and they do very well in athletics and the extra co-curricular activities in their personal and social development also. Auditory training. Perception of various speech sounds is possible through auditory training. Through this, the child distinguishes one voice from the other. This type of training provides a thorough understanding of the principles of hearing rehabilitation, lip reading, speech development and test of hearing educational diagnosis. Nursery education. Informal education system like nursery education is quite beneficial for hearing impaired children. Necessary provisions and useful settings are generally found for the assessment of these children's need. Nursery education is very helpful to increase the self-confidence in children with hearing impairment. Then the next educational provision is classroom arrangement. The hearing impaired child in a classroom should be front benches. Accordingly, the seating arrangement should be made, and again they must take their seats very closely to the teacher, and the teacher may use a reasonable level of pitch while speaking to the child with hearing impairment. Then the next educational provision is the speech reading. Speech reading is an art of understanding the speaker without hearing, just by watching the movement of lips and tongue and other facial expressions. Of course, teaching the speech reading is very tedious job. It requires labor, patience and tact on the part of both parents and teachers. Then the next one is awareness of the assistive devices. Training in use of assistive devices is one of the parameters of success in educating the children with disabilities. But the only provision of these devices would not be sufficient. The children must also be given adequate training to use them. These devices are usually taught by the special teachers, and general teachers only encounter situations to teach these skills where special teachers are not available. Short-term training for these regular teachers in using these devices will be helpful to a regular teacher when dealing an inclusive classroom with a hearing impaired child. Now let us see quickly what are some of the assistive devices that helps the hearing impaired child. The first one is the audiometer. Audiometer is an equipment for assessing the hearing ability of the child. And the next is the speech trainer. Many hearing impaired children have the ability to speak. Therefore, individual speech trainer is normally used to develop their abilities in speaking. And the next one is hearing aids. Hearing aids are the vital tools for enhancing the residual hearing power which the children will be having. And the next important tool is hearing aid test box. Hearing aids often go out of order, or there may be some difficulties in the amplification process. Therefore, there is a need for testing the quality of hearing aid and the amplification process so as to make appropriate use of the hearing aid. Then the next assessment device or assistive device is the group hearing aid. Hearing impaired children needs training in speech. A teacher cannot provide a speech training individually as it consumes a lot of time. Therefore, it is suggested to have a group hearing aids through which the teacher can produce sounds and words and the children hear the same through amplification devices and respond back to the teacher. So, we have understood today what is hearing impairment and the need for early intervention, and we also have understood some of the practical tips, the curriculum adaptations and the inclusive strategies or teaching strategies when having a hearing impaired child in a regular classroom. We understood that there is a range of inclusive teaching strategies that can assist all the students to learn, but there are some specific strategies that are useful in teaching a group which includes the students with hearing impairment. In considering the alternative forms of assessment, equal opportunity is not a guaranteed outcome, is the objective. Keeping the instructions brief and uncomplicated is the objective when teaching the hearing impaired child. When repeating the instructions, present the lecture information in a visual format. These are some of our points or teaching strategies when teaching a child with hearing impairment in a regular classroom. Hope you have understood the lesson. Thank you.